Hello and welcome. This is Dr. Peter Nixick, resident at the University of Wisconsin, Division of Plastic and Reconstructive Surgery. On behalf of the Poor Lab, we would like to thank you for watching our supplemental video on vertical end-to-side microanastomoses performed by Dr. Wei-Fang Zhang. This video will cover Lesson 9B of the Microsurgical Training Manual, vertical end-to-side microanastomoses. The distinction between horizontal and vertical end-to-side microanastomoses lies in the orientation of the vessels. In this situation, the recipient vessel is vertically oriented, which affects the sequence of sutures and needle positioning. The first step is to create the arterial window in the recipient vessel. One easy way to do this is the needle method, which has been described in previous videos. A bite is taken in the recipient vessel equivalent to 2/3 the diameter of the donor vessel. You then use the micro scissors to make the window perpendicular to the needle. This method ensures that the arterial window is created efficiently and of appropriate size. The sequence of stitches is of the utmost importance when doing end-to-side microanastomoses. The first stitch is placed in the surgeon's forehand at the 180-degree position furthest from the surgeon. The next stitch is placed in the back wall, first in the recipient vessel, then in the donor vessel, both in the forehand. It is helpful to work top to bottom, left to right, like you are reading a book. This will prevent you from getting in the way of your subsequent sutures. It is important to travel the same distance between the donor and recipient vessel. The rest of the back wall sutures are thrown in this fashion until the surgeon reaches the 180-degree position closest to him or herself. This suture is then thrown first into the donor vessel, then the recipient vessel in the forehand. This then leaves the front wall of the microanastomosis, which can be thrown in the forehand and taken in a single bite. One indicator that you planned the microanastomosis appropriately is that each subsequent stitch should be easier to throw than your last. The divide and conquer technique is used here to ensure equal suture placement on the front wall. However, you can choose to run these sutures to save time and decrease risk of back-walling. When your bites are taken and before you tie down your first knot, differential tension on the ends of the sutures will ensure perfect approximation of the vessel walls. When the anastomosis is complete in the blue blood chicken thigh model, methylene blue dyed saline is then ran through the anastomosis to check for leaks and patency. This concludes Lesson 9B of the Microsurgery Training Manual. Thank you.